Good afternoon. I'd like to call to order the January meeting of the Buncombe County Health and Human Services Board. Welcome to everybody. In the weather, we're glad to see you. We do have a forum, so we can do any business in case we have it. Do we have any question in regards to the agenda? Any changes, additions? If not, do I have a motion that we approve the agenda as presented? So moved. Moved.
Second.
Second. Any questions? All those in favor say aye.
Aye.
Aye. Move to the minutes, the last meeting. Again, we have seen these minutes. Does anybody have any corrections to them? Or in addition or subtract? Not, do I have a motion that we accept them as presented?
So moved.
Move.
Second.
Second. Any questions? All those in favor say aye.
Aye.
Opposed, same sign. Thank you. Jim, that brings us to you, my friend.
Okay, thank you very much.
I might ought to say that, before I do that, we certainly want to thank our new board member, and she's got her head down over there. She's getting used to being a board member. But anyway, thank you so much for taking on this task. We look forward to you working with you. Thank you so much.
We have Commissioner Belcher.
Commissioner Belcher, I knew he said.
Vice Chair Belcher. I gotta get this.
Vice Chair. So we have almost a quorum here. Commissioners, but we don't. Okay, thank you. Okay.
Thank you. Good afternoon.
Good afternoon.
In your iPad, you'll see a snapshot of our financials through December 31st. So we are 50% through the fiscal year. And we'll start with DSS and looking at those, and see graphically, you'll see overall our target is 50%. There are a couple of areas where we're over that target. Again, just to show you how the graph, the mountains behind that, the gray represents where we were at this time last year. The line through represents where we are in the fiscal year, 50% through the fiscal year, and then the bars actually represent our actual spending through the end of December 31st. And you'll notice that there are a couple of areas where we're over the percentages of 50%. That's in administration, where we have those one-time expenses, unemployment insurance and workers' compensation. We've also had one-time expenses across for longevity that are budgeted. In income maintenance, you'll see that we're over there, and that's a direct result of the work that we've had to put in bringing on temporary staff for NC Fast. As you may know, the commissioners 2 meetings ago, I believe, approved a recommendation that increased the staffing by 23 and provided the funding for those. So the temporary staff that were doing that work, we were able to show the need for those staff, and commissioners generously approved the addition of those and the funding, so that will be reflected in subsequent reports as you see there. One of the things I did want to point out that was a suggestion from Vice Chair Belcher was to look and see what we would look like if we had those one-time expenses removed from our expenses. And you'll see if we did that, we're still overall in salaries, but you'll see that those one-time expenses, especially in admin, reduced those costs and put us right on target. And as we talked about within income maintenance, we are over that, and that's because of the expenses that we've had in temporary. We do projections, and we look at this, where we'll be at the end of the year, and based on even our worst case scenarios, we will meet our budget targets, and we will not be over budget. That will not be something that we will meet.
Jim, I just
Yes,
have
sir.
one simple question.
Yes.
On my computer, that orange line is not over the bar. And I'm trying to see if we have a different data.
You don't have different data. What was sent out in your packet, the graph was cut off.
Okay.
So you didn't see that. So I'm sorry, it was supposed to be corrected on
That's our
the,
new technique.
Cut it off, just cut it off.
it was cut off, so
Okay,
I
thank you.
apologize for that.
Thank you.
It was
Just
supposed to
want
be corrected on
Make
your
sure what I'm
report.
saying. She says I'm too persnickety.
No,
That's a pretty significant
yeah,
issue.
that,
Oh, we showed him anyway.
I noticed the same thing.
Okay.
Thank you. Any other questions about the DSS expenditures? Then we'll go to public health and look at the same area. You'll see where we are. You'll see a little bit higher over in salaries, and part of that is simply because of numbers. There are more people, there's a larger denominator within the DSS budget than there is within the health budget. So when expenditures are a little higher, proportionally the dollar amount looks higher. Same thing that you'll see here when we look at that with those one-time expenses removed, you'll see administration where those expenses are under 50%. Clinical is slightly over, and that's as a result of temporary staff that we've had on board. Community protection and preparedness, that is one that is over and that we know that that is, and that's a result of adding 3 additional positions for inspectors in the environmental health area, based on need that we had determined in our food and lodging program. So that's an expected expenditure. Again, projection through the rest of the year that we will remain under our budget targets. And I'm happy to answer any questions that you might have in public health.
Jimmy, environmental health positions were positions we reallocated within health.
Thank you for that. Yes, those were not new positions. Those were ones that, as we always do, look internally to see where those positions, where the need might be met from other areas. That's one of the work that we continually do. And we found those positions internally.
And Jessica has used those positions to get us on target on restaurant inspections, so yeah, we'll target that.
Thank you very much.
Thank you. I think that I need to put an addition in here that I'm sure that your new chair will make sure it's always done. I should have read, in accordance with state government ethics act, the duty of every board member to avoid both conflict of interest and experience of conflict. So now it's on the agenda notes. Okay, we look forward to this next thing every year, and this year, hopefully, it's going to be very, very good. But anyway,
I think most of you know Tom Kavik because he's been with us most Januaries. I think since we actually, even before we consolidated, when we started meeting jointly twice a year, a research economist who always helps us begin the calendar year and as we plan for the next fiscal year, understanding significant changes in our local economy and some relevant demographic or census data that will help drive planning for this year. So welcome again.
Thank you, it's great to be here. I'm going to do something a little bit different this time, but let me tell you why before I start doing something different. And that is, how many years, like the 4th year or 5th?
I think it must be.
And I see a lot of familiar faces around here, and this sort of reminds me when I was at the chamber, I got in this position that I'm in right now, and that is that the economy looks pretty darn good. And almost every variable that I would normally show you, and we'll talk about a few of them, it looks good. And that's sort of a boring presentation. I mean, most communities would die for that, but I don't want to talk about the same things we talked about last year and saying that they're better, and most things are. So Rick would agree with me, we have incredibly low unemployment right now. The metro is the lowest in the state, which if you look back in history, we've bounced around the lowest anyway. So we're sort of back to the same spot. So let me go 2 slides here, and that'll be my economic overview. And then we'll go on to another subject, and I think you'll appreciate learning about that. For those of you that are somewhat new to this, just quickly let me tell you what I do. Andy mentioned it already, but I go to communities and I tell them what's going on, and that's about it. I'm not supposed to have an opinion. I'm not supposed to tell them what to do. Last year I spent a lot of time in the state of Mississippi telling them about their skills of their workforce. They had these grandiose ideas of what they want to do with their skill sets, bring in Boeing and all this stuff. And my job was to come in there and say, guess what, guys? It ain't going to happen. They don't have the skill sets. And so they paid me to do that, just to get a better view of reality. I was in Texas doing the same thing. I was in our neighbors out in Wilmington. I spent a lot of time out there. Same sort of thing, saying here's what's going on. You do with it what you will. And so that's my role. My role is to inform you, to help you make better decisions. I shouldn't be telling you what those decisions are. That should be you. So that being said, as I go through my slides, if you see something that you, better? If you don't understand or you have a problem with something, you're not going to hurt my feelings if you interrupt me and say, I don't understand it, or can you explain what that means? This is for your benefit. This is all about you. When I walk out that door, my only goal is that you understand these items better, and you can make better decisions. So there'll be too much talking there. Buncombe County, this is my 2 slides on the economy right now. Specifically, this is Buncombe County employment. You can see the recession there, the drop off. You can also see since 2013 where we have more employees than we've ever had, more people working in Buncombe County. The growth rate is about 2%, between 2 and 3%. If we compare this to what's happening percentage-wise, state and the nation, you can see we're pretty much in line with the same pace, a little bit higher in 2013, and then it would come back. So things are chugging along, as I mentioned before. I think there was an article about building permits this morning that was mentioning the surge in building permits. Most variables are looking good. And at the end of this, I'm going to give you plenty of time if you want to ask me a specific question about things like home sales or building permits, we can talk about that. But relative to where we were, relative to last year, everything's pretty much on the bright side. Except for one thing, and that's what we're going to talk about the rest of my presentation, and it's something I'm curious about, and I think you would be too. People in my profession, I have trouble with a lot of people in my profession because they have very high respect of themselves, and they like to tell you what's happening all over the world and why it's happening. There's one issue right now that is very popular, and it's a political issue too, and that is, what about wages? How come wages aren't going anywhere? What about income? And you hear it everywhere. I think we're going to be hearing it as we go into a presidential election. And there's probably half a dozen books, economic books out there mentioning why wages aren't increasing. And it's the full gamut. It's because of automation, it's because of skill sets, it's because of returns to capital. You've probably heard some of it. It's 30,000-foot stuff that I don't feel comfortable with. But it is a question. And like most economic questions I have found, there's much more likelihood of there being an answer when you look specifically at a local economy. So what I'm going to do for the next 30 or so minutes is take you along the journey that I had to try to explain why perhaps wages are not doing anything, if they aren't doing anything here in Buncombe County, and if there's reasons. And I think we're going to come close. We're not going to have the complete answer, but I think at the end of the talk, you'll feel much more educated when you hear someone say wages are stagnant. Why might that be? So here we go. We're going to look at different ways of measuring wages. The first one is per capita income. This is a national number. This is put out by the Bureau of Economic Analysis. Per capita meaning it's the total population divided by the income that's coming into the county. And so you can see there that we're a little bit below the state and more below the nation, as we have been for quite some time. That's nothing probably too surprising. If you kind of squint one eye, you can see maybe there's a little bit of a spread. Maybe we're falling behind a little bit more than the nation. You can also see the impact of the recession. Now, what I'm going to do next is take out inflation, just so that you get a feeling of what inflation is. If you look at inflation, inflation is what you can buy with it. So I'm taking out inflation, so we're correcting for the rises in values of things, not actually what you buy. And over a 20-year period, that's about a 60% change in just the prices of things that have gone up for the same things. So this looks a lot different when we take out inflation. And then you can really see what people are talking about, or income flattening out. You can see that really we've had not much of an increase at all since about 2007 or so, and actually some declines back in the recession here. The wages didn't keep up, they actually declined as a per capita term. If you look over 10 years, 20 years, 10 years, and 5 years, you can see the changes, and you can see what probably is most shocking is over the last 5 years, if you measure the changes in per capita income, we've actually lost $161. In other words, you're paid the same amount, but you buy $161 less. So it is a problem. You can see the nation and even the state, even though there's been a minor increase, there's something going on here. Something's wrong. Wages are not, or per capita income is not keeping up. Now, this is an area probably that you're more expert than I am, but income has 3 main components to it. It's earnings, salaries, wages, what people make who are self-employed, investment income, dividends, rents, investment, that kind of stuff, and then personal government transfers, which you are all experts in knowing and know more than I do about it, but that's everything, Social Security, Medicare, Medicaid, all those dozens of programs.
I just have a quick question. Is inflation specific to Buncombe County or that?
No, this is
You
national
use the
inflation.
national number.
Yeah, there's no local, unfortunately. Wish there was.
I think what's so relevant though about all this is why we keep getting asked the question, employment's up, but 1 in 5 people are on food stamps, or 1 in 5 people are on Medicaid. It's that income. It is that most of them work. It's that income.
Yeah, we're gonna get more into that, but you're exactly right. So here's that same chart. We're doing the change. This is just over those components of per capita income, and this one's sort of scary because if you look at the personal government transfers, that's the only one that's on the positive, except for over the 10-year, which is just a blip. So you can see, especially over the last 5-year period, the per capita income, take out inflation, the only increase is coming out of these personal government transfers, which is an unusual situation to be in. And as you probably know, there's not a lot of there's not a lot of potential to get much more out of this. I did some work in Lake Havasu, Arizona. I don't know if you're familiar with Lake Havasu, Arizona. It's a retirement community. Almost all of their income for the last 10 years or so is retirement income. And so there's no way to get it up. These people have pensions, they have 401ks and that sort of stuff, which comes in steadily, but there's no way to bump things up. You can't bring in a big company and raise wages yet.
So how does all this work into the ages of a particular county or state?
Directly related to that. I mean, a good portion of that. We're going to talk a little bit about that, but it has to do with an aging community. And as a sidebar, you probably saw the paper this morning if you did. It's a little quote from me, and it's more important than just a quote, and it says that, this area attracts 2 groups, and this is, I didn't just make it up, I've been following this for years. It's retirees or early retirees from out of state, Floridians, and then it's younger folks in their 20s from within the state. And then I would tell you what they didn't quote me, if you follow those numbers through, what usually happens in aggregate numbers, the middle age group kind of disappears, which probably gets back to the wages, the kind of jobs and that sort of thing. So that's a historical thing that's been going on a long time, and so we're aging and we're getting older, and that's part of living in a beautiful place that people like to come and visit and decide to move here in the long term. We're going to break those components out I just talked about. This is the purple, broken out into the main categories, and again, you're the experts here. Medical, Social Security, income maintenance, which is all the programs like SNAP and earned income credits and all that kind of stuff. And as you can see, and I'll do the next chart there, the real growth, unsurprisingly, is in Social Security and medical.
Is medical Medicaid and Medicare?
Yeah, it is. Yeah.
And that's staggered.
And as was mentioned before, a lot of this has to do with an aging population, but disabilities in here too, as I recall. I was talking to Lisa earlier. It's one of those questions, I wish I had more time because I know the whole disability issue and how many people are on disability, which is another data set would be interesting to look at. So that was per capita income. Now we're going to look at, remember, earnings were a big portion of that. We're going to just look at the earnings side, which is wages per job. So we're going to different data set, but looking at earnings, more focused on jobs. Now, this is a number that is used a lot, and there's a problem with it, and you're going to get it already. It's average annual wage per job. So this is just an average of the people working. And we're going to talk about different industries in a minute, but I'll tell you right now, we have a big disadvantage because we have a tourism-driven industry, and a lot of those people work part-time. So you remember, this is an average. We're just going to average the whole thing out. So if you work part-time, they're just going to take that average for the whole week. So we're at a disadvantage there already, so you need to understand that. Here again, if we take out inflation, you can see we're flat since about 2003. More than 10 years, average wage per job is flat. And so you would say, oh, that must be because our employers are holding money back, or we get paid less here. Well, that's really not the evidence, and I'll go a little bit deeper and explain why that is. By the way, if you do have that mindset where you say, we get paid here less than for the same things, that really doesn't hold true across the board. It holds for certain industries. So, for example, I just looked yesterday, medical pays more here, average, than it does in the nation. Restaurants pay about 0.5% less, not a whole lot. Which gets into economics and what you're good at, and what customers are willing to pay and that sort of thing. But it's not that unique here than it is anyplace else. There's something more that's going on. Here we take out the, I just zeroed it out in 1994, just to give you an idea. So very little increase in the last few years, and $2,000 net over the last 20 years. And here's how that looks, same way of looking at it here, with a decrease of about $250. So here's probably what you might be thinking about. And what I did here, let me tell you, I looked at the 30 different industries in the area, and I said, which ones are in the top quartile, pay the top 25%, and then look at the bottom 25%. Not necessarily the people, but the industries. So industries stay fixed, and then we're saying the number of people employed. And what you can probably see here is the bottom 25% has seen the growth. So about 30% of the total population was employed in the bottom 25%. Now it's about 42%, I think, or 40% maybe. So a huge explosion in the number of people that are working in industries that are in the bottom quartile, the bottom 25%. The top 25%, the percentage really hasn't changed that much. What's interesting, those big jumps there, what that is, now remember, this is just me measuring the top and the bottom. It's manufacturing. So manufacturing sometimes is in the top, sometimes it falls right below, which is a factor of manufacturing, and it's also a factor of those top 25%. So when wages surge in that top 25%, for example, before the big housing bust, obviously finance and those sort of industries, wages were going up. That bumped manufacturing out of the top 25%. Now manufacturing is, this goes to 2014, by the way. 2014, and manufacturing is back in there. So the mix of manufacturing. I didn't have time to present a slide that you would, that I could feel comfortable with, but I did look at education, and it gets a little complex, and let me see if I can explain it to you. So I did the same thing, but I did it by levels of education and by industry. It took me so long, it didn't make it to the final deck here. But what's interesting, and a couple things that I thought was interesting, was, for example, people with a bachelor's degree or above. Back here, there was like 3% of the workforce. Here, in the 25% have a BA or above. Here, it's about 8 or 9%, which maybe is that underemployed question you hear a lot about. But the number of highly educated people in the bottom has grown. Another interesting factor, and you would all understand this too, when you looked at some of the higher wage jobs back earlier here, you could see people with less than a high school degree in manufacturing making the top 25 wages. You don't see that anymore. So manufacturing Probably the skill level is a little bit higher than it used to be. What you see in manufacturing, a lot of people with a community college level degrees and above. And then, of course, what's gone unsaid here is that middle 50%. That 10 or 15% increase down here has really taken it out of the middle piece. And so the middle is all those industries that are stuck in the middle there, and that over this period of time has been declining. So here's how it looks in that same 20, 10, and 5 year. Hope you understand how this works. And you can see that the top 25 has been growing here. I've got a slide here we're going to talk a little bit about. It's not like it's gone away. It just hasn't kept up with the pace, the relative pace. Now remember, this is all in context to the average wage per job. So what this is telling me is the average wage has been influenced by the composition of the industries. More people are working for lower wage industries, and so that's bringing that average down, which is unique here. And remember, this is so every community is going to have a little bit different look and explanation. So no surprise, here's those industries here. These are the major ones. We all know about leisure and hospitality. Remember, I came from the chamber. This is a good thing. You know, I'm not one to beat industries over the head saying this is a good industry, this is a bad industry. They've been very successful, but it's an industry that will never be known for high wage jobs. Nursing care is interesting because nursing care does not have high wages. It's part of the whole healthcare thing, and sometimes they're thrown into healthcare, but they're sort of a separate thing, and they have not grown that much, but they've been a good portion. This is an interesting one, and I just read my first paper about this the other day. I've been begging for someone to write a paper on. This is a national phenomenon. Administrative services, those are temps. And there has been, you can't really tell, but there's been a pretty good increase in administrative services in the last couple of years. And the reason I've been waiting for a paper, this is a national phenomenon, is why is that? I can make a guess. And the paper made some guesses too, and it's firms not wanting to hire permanent employees. So, you know, then you fill in the next blank. Why is that? Are they afraid the economy is not sufficient? Is it because of the Affordable Health Care Act? Because they don't want to get permanent people on there? Is there other reasons? It's not a healthy thing, I don't think, but there's been a boom there, and doesn't pay very well either. And then obviously retail. Retail, by the way, is really connected at the hip with leisure and hospitality. That new mall that's coming, they asked me to do a study, gosh, probably 3 or 4 years ago, and it was on the retail market here. And part of the study was how much more retail spending per capita there is here than there should be, which I know and you know is because people drive in from outside and they're tourists and they buy stuff. So I can't remember, it was like, I think per capita is like double of what it should be in retail spending, and so I think they made a good move, and they said we want to be a part of that. So what's the other, first of all, see the total increase there, just so you get an idea that it's all up. Let's look at the next one, and this is the top 25, and outside of manufacturing, which sort of skews, it makes it look like it's all declining, but you look at the top number, it's stayed about steady. We're not losing in aggregate the top 25, but we're not increasing very much. You can see the big increases are in ambulatory healthcare and hospitals primarily. So the healthcare industry has really held up wages and has really provided the bulk of high wage jobs here for the last 10, even 20 years. Manufacturing, you would know it. People in economic development would love to tell you about it, and they should be proud. It's really leveled off here, which is something to be proud of. It hasn't been declining. It's been bouncing around the total number plus or minus 100 or 200 jobs. And you know, when you get a couple breweries in here, we may see that increase a little bit. So it's been a pretty good turnaround, a little bit unique to this area, and something to be proud with about. The professional and technical services, those are the knowledge workers. Those can be computer design, lawyers, landscape architects, that sort of stuff. We've seen pretty good growth in there, but nothing enough to really bump up those average wages. So hopefully that gives you an idea. That's sort of the answer behind how come average wages are not or are flatlined right now. It's primarily because of the mix of the industries, what people are getting their jobs in. So this is another way of looking at it. This is median household income. That's just a measure of all the money you get in a household. This is the one that's probably talked about the most. It's a census survey kind of thing. And as you can see, I did not take an inflation out of this. I just took their raw numbers. They only do a survey for certain periods of time, so you can't get a year-to-year change, but you can see where we're at. It actually went down a little bit from the first survey to the second one. And I'll tell you what this is telling you, because it's really hard to see, but once you see it, this is just the household income broken out by income categories. And what you'll see is Buncombe is higher in all categories relative to the nation up to 50,000. And then everything over 50,000 we're low. So obviously a strong bias on the lower side of things. Now I've got some slides here that I think help to explain why that is. It is not just that. Incomes are lower. Now we already know that earnings are on average probably a little bit lower, but there's another factor that goes into this, which actually gets back to our question about who's moving here and why. So here's the sources of household income. We talked about this from another agency, and this is the Census Bureau asking this, the same sets of questions, but they're doing it a little bit different way. And this is just saying, in your home, what are the sources of your income? Not necessarily how much, but do you collect income from these sources? And as you can see, we're lower on earnings. So we're a few percentage lower on homes that have earnings. Higher on Social Security, higher on retirement, a little bit less on supplemental, and not big differences there on the other two. This is a significant one here. Remember, the high end, the ability to create wealth and raise your earnings, that only happens here. The rest of these are pretty stable, and you're going to get what comes in the mail kind of thing. So here's the earlier survey, 25 to 2007. It's an average, by the way, for those years. And what I thought I would do is say, okay, what's the latest survey show? What is the difference? So the little orangish things, that's the change. And you know, this really comes out even better. These are number of homes, by the way. If I read these out to you in percentage terms, because they're actually pretty dramatic in percentage terms. So the top one there, with food, they still call it food stamps, or it's called SNAP now, or it's got another name?
FNAS.
Okay.
Food
Can never
Nutrition
keep up with
Services.
it. That's a 90% increase. A 90% increase
Have you felt that, Philip?
that get those benefits.
Can I ask you a question?
Sure.
You're saying that there are 6,600 families who survive solely on?
No, not solely. That is part of their
As a
income.
factor in those,
Yeah,
so they may appear elsewhere.
absolutely. In fact, yeah, these are not separate categories. They could very well overlap one another. I suppose you could have all categories, perhaps. So that's a 90%. This is only a 3% increase. This is the smallest increase of all. So households with earnings, only a 3% increase over this period of time. And then with cash public assistance, that's a 40% increase, and SSI is a 55% increase. So in percentage terms, the big increases there are outside government transfers coming into the household, which we saw in some of the other databases as well. It's always good when you have two separate databases and they agree with each other. Number of workers in the house. This is obviously important to earnings. And as you can see, no workers were only 1% more than the nation, but a little bit, there's a difference, and one worker were larger, and then the other categories, 2 or more, less likelihood of being more than 2 or more workers in the house. So obviously the composition of the household, remember we're talking about the median household income, and so we're saying, is a household a household? It's not. A household in Buncombe County is going to be different than a household elsewhere and that's gonna impact those numbers.
The bottom bar chart define workers, I mean, that means that they do not.
They don't have anybody that's employed. Employment would be another way.
But it's not unemployment.
No,
They-
no.
I mean, they are getting some
No,
income.
they're just, in this one, they said, do you go to work? Do you get income from going to work? That would be the question.
That's probably retirement. right?
Yeah, it's probably retirement.
Don't get them on those retirement.
That's not necessarily getting a assistance.
No.
Just not one. Just not one.
And then we're gonna do the same thing and look at the change here, and I'll read you the percentages. So it's a 20% decline in 3 or more workers, and this is about a 13% increase of no workers in the house. So whatever we're getting more of it. We're getting more homes that have no workers in it. And we're getting fewer homes that have 3 or more workers in it. So obviously, if you were looking at household income, and this is helps explain why it's lower, and this is also going to help explain why it's probably going to continue to get lower. You know, somewhat unsaid in all this is if you have a policy and you want to affect this, you're going to be running up against the stream here. You're going to have a real battle because the demographics are fighting against us. Household type, this is very important, obviously, when you think about it. Married couple, this is a married couple with children under 18, somebody living by themselves, and a 65-year-old living by themselves. And as you can see, there's some big changes. The living by yourself, there's a pretty big gap between what we have here and what we have in the nation, and less here. And if we look at that in the percentage difference, it's pretty dramatic. We're looking at a 2% decline, and that's like a 15% with people living by themselves, and 14% of 65 and older living by themselves. So big change in the kind of homes that are around. So we're going to switch gears again because there's still something I haven't talked about, and if I haven't put you to sleep with charts, and that's what about the really high income? And so I had a client a couple months back say, you know, we know that in Asheville there's high income people and they're coming here and they're moving here, and isn't there some way we can measure them? And I thought about it for a while, and you can actually download your IRS, not here, but you can download aggregate IRS data down to the zip code, which is sort of fun. Remember, it's a different format, different questions being asked, so they're measuring things a little bit different. But I looked at Buncombe County for the last 3 years. That 2012 is the most current data, and this is people making, or households typically, adjusted gross income 100 to 100 to 199 and 200,000 and above. And as you can see, it's not a lot of people. It's a good number of people, but you can see it's increasing. Now, when I compare these percentages as a percentage term, it's less here than the nation and the state. I think for the 200 and above, I learned not to say things I'm not comfortable with here. 200 and above, that's about 3% of Buncombe County homes. In the nation, it's 3.6%. So that's actually 2.7 to 3.6. It's 2.8 in North Carolina. For 100 to 199, it's about 10%, and in the nation, it's 14%. So the growth, I'll show you the growth here. The growth is outpacing the state and the nation and the higher income groups, but the relative percentages are still lower than the state or the nation. So you could interpret this as we're catching up or attracting those folks that we haven't attracted before. And this is the 200 and above, which there again is pretty strong growth in percentage terms, but as an aggregate, it doesn't make up a big piece. So I'm flying through my slides here. I hope you have a lot of questions. So this is the bonus slide, and this is something what you want to do is you want to have a client ask you a question that you've always wanted to ask, but you don't have the time or the effort to do it on your own. So I had a client come to me and ask me, so tell me about the second home market. We really want to know what is the second home market, how do you measure it? And I thought and thought about it, and this is my guess at it, and you can tell me if I'm right or wrong. I downloaded all the parcel data, and I pulled out those parcels that the bill for their taxes went to, not the residents here, but went to a primary residence somewhere else. And it was fascinating, and here's what it looks like, and we can talk about it. There's where they live. These are second homes. I made a 50-mile radius around the city of Asheville, so we wouldn't have people that own two homes here in the community. So these might be rentals, but a lot of these probably are not. It's about 10% of all homes in Buncombe and Henderson County. Their owner lives, primary resident is outside the area. About 28% of them live in this state right here. And then the next state is North Carolina, the eastern part of the state, and then I believe South Carolina, and then it folds out pretty fast afterwards. I also looked at the value of the homes, and the values of these homes are, which is sort of interesting, are about 15% higher than average. So if you own two homes, the one home that you have here is on average about 15% more valuable. I grew up right here, so you can actually, on the map, you can zip down and you can actually hit their house. And so the question the client had was, are these high-income people or low-income people? And I said, I really don't know. We don't know. We know their names, we know their addresses. But I know, I grew up in Santa Barbara. Santa Barbara is like Buncombe County on steroids, meaning, you know, that's where they've got tons of wealthy people. And so I drilled down to these folks' homes, and these are in very expensive neighborhoods. Meaning these people probably are not renting their homes out. These are people that, you know, come here and fly in the weekends and fly out. The point about this, and why I have that slide here, is these people are not counted in any of the stuff I just talked about. They don't show up anywhere. They don't show up in household income. They don't show up in per capita income. They don't show up in average wage per job. They could show up in average wage per job if they were showing up to an 8 to 5 job here. I sort of doubt it. But that's a factor in the wealth of our community that contributes, but we really have very little way of measuring that. And so it influences the area. We all know there's a lot of high-end developments around here, and you look at those numbers I had before and you say, wait a minute, you know, how could you have these lower than average wages? But we do have a considerable number of people that have second homes here.
How many orange dots did you come up with?
12,090.
12,000.
Yeah, I think that's right. Well, wait a minute, no, 1,200. It's about 10% of all homes. And I didn't do condos, I didn't do apartment buildings, I just did single family residence. So, these are my observations, but then if you want to talk about the economy, I'd love to talk about the economy. It doesn't make for some good slides. 5th year of job growth. I tell you, I was in Mississippi last year, I was in Texas, Wilmington, up in West Virginia. Those places were all struggling, and so I'm giving you one bullet point here that those communities would all die for, and I almost apologize that we're not talking about how good the economy is here, because it really is good right now, and things are happening well. And in the 5th year of consistent job growth, by the way, it equals out to about 2,000 or 3,000 net new jobs every year, 2 to 3%. But we all know that wages and income are lagging or stagnant, and that personal government transfers are growing, and they have been for a while. When you look at some of the data, I think we can probably all imagine that it will continue to grow. And that I would say one of the major reasons that average wages are lower here is just because we've had a lot of growth in lower wage industries. Not necessarily a good or a bad, we've just had growth in lower wage jobs. Obviously there's some policy implications there, But that's where the growth has been. So a job is not a job. You know, when you get to a point where you have good job growth, then communities begin to talk about the quality of jobs. If you don't have job growth, then they talk about just getting jobs in, period. We've made that hurdle, and we're on to the next. Changing the household composition is what hurts a lot of our measure of income. Now, obviously, our earnings, average wages are going to be lower, but the houses are smaller. A lot of people living by themselves, a lot of older people, a lot of people making passive incomes. When I showed you that IRS data earlier, the 200 and above and 100 and above, I should have mentioned that when you compare the sources of their income, which you all know if you've looked at your 1040, there's about 6 different categories. Their incomes for the higher income groups, relative to the state and the nation, they're not from wages, they're not from salaries, they're not from businesses. They are from passive income, capital gains, IRA, dividends, retiree kind of stuff. So the people in those groups, I should have mentioned, are impacted heavily from those passive income. And then finally, that little group that we need to recognize is increasing faster than the state and nation. So it's somewhat of an outlier, but it exists. It's probably more visual than a lot of the demographic groups we just talked about, but it is happening and it's growing along. So now the part that I enjoy, it doesn't have to be about income. It takes a while usually. Good, yeah.
Okay, so something I think is extremely positive nationally and particularly locally is the fact that our gas prices have went from $3.80 to about $2. Now, in most of these areas, the average person you run into, everybody's doing a happy dance. I mean, they're just, it's the most exciting thing going on in most of those poorer households. They will have more money to pay their bills. Stress will go down. There's a lot of very, very good things individually that has occurred. And I'm wondering if you could take that information in a county where we have so many people that, you know, that is a huge impact on their household, that you might comment on that if it stays down, you know, for the next 5 years.
Yeah, I mean, it's like a bonus. In fact, I just heard a speaker the other day. They're looking for, because it's relatively new, where that money is being spent, because it's being spent somewhere. That's savings, which is probably some retail stuff and stuff like that. But it's like getting a raise. It's like getting a raise, and it's unusual that it's so you know, the fossil fuels are so politicized that that somehow is missed, but it is an enormous expense. And you could run it through a model and see, because different households, by the way, different households' incomes have different spending patterns, as you all know. Lower income people are spending, you know, a greater proportion on food and that sort of thing. So in that way, logically, you would say that, you know, that's going to go to food and that sort of thing, whereas higher income, we put it in the bank. Yeah.
So have you studied other communities where they had a living wage applied to the communities or within the communities? And what impact would that have on, or has had on other communities, on job growth? Because the argument on one side is it's going to force you, maybe you won't get the growth you want in the area, and the other side is we'll bring up the median income. So have you had other communities?
Well, I probably read the same. I mean, there is no definitive answer. I mean, the one side would say, and I get, you know, that you're, obviously the one side's going to say you're going to increase wages. The other side would be you're not going to hire some people too. So there's been some huge studies. The problem with those huge studies is it's really hard to see it. You know, there's so many moving parts with something like that. It's very easy to identify the employee that's got a wage increase. You can't measure the kid who didn't get a job. So, you know, I think it'll be really hard to, it's more of a value kind of thing. And there's probably, I think that is probably the most studied of any one subject. Now, I've got 2 kids. I've got a 23-year-old and a 24-year-old who work in that leisure and hospitality industry. And there's a part of me that says, as a dad, I'd like to see them get a little bit more money for all the work they On the other side, I understand that there's no such thing as free money. It's coming from somewhere. Yeah.
You mentioned our unique set of demographics. We attract old
Right.
and the younger crowd, and it's tourism-based predominantly, mixed in with healthcare. Are there any other areas we can look to, counties or cities with our unique set of characteristics?
That's a good question. There's probably nationwide, there's a bunch. Wilmington has come to mind. When I was at the chamber, you could look at Wilmington's economy and ours were very much alike. They went off the deep end because they overbuilt, because it was much cheaper for them to build. So, you know, this is just sort of a sidetrack. Homes here are more expensive. Part of that is because it's an expensive place to build because of mountains and Wilmington, they have huge tract areas, gated communities that are still sitting empty, a lot of them. So we have since diverged, and our economy is actually doing better. We've gone through our inventory, which wasn't a whole lot to begin with, of housing. This is sort of the policy side. That community, if you talk about manufacturing, they get a little squeamish. There's a lot of people that don't want manufacturing there, and what's different about our community, people here, not 100%, but people still value manufacturing and they want to see manufacturing. That community is actually shutting their door and saying we don't want to see any more of that. But they have the same demographics, retirees and the younger folk. And that's one of those things, you know, I don't like using the word forecast just because so many people abuse it, but you can see the trends and you see why those trends are, and you know that these trends will most likely continue. Let me get to the tourism attraction of people. I did a survey, gosh, probably 10, 15 years ago, asking people about tourism and why they came here and that sort of thing. I've thrown this story around a lot, so stop me if I've mentioned it before, that I had some Western Carolina students doing the survey, and they were surveying people on the street, tourists, asking them why they were coming here, if they were going to spend the night, that sort of thing. First day of the survey, one of the surveyors came to my office and said, can I add a question myself? I said, yeah, but why would you do that? And she said, because inevitably the question comes up about people wanting to move here after having visited here. So we actually changed the survey, and bottom line was that about 15% of the people who had visited here for the first time during the event, they had made a decision, now we don't know if they really did it, that they would like to someday move here. So that leisure and hospitality industry directly feeds back into those, it's like an advertisement. Like a living.
Did you happen to look at their income level?
Well, on that survey, no, but I mean, the Chamber has done surveys on that, and it's the higher income for the most part.
Like over 100 or over 200?
No, it'd be like 75-ish. And then, you know, we could talk about that. That's a whole separate subject by itself. If you read the paper lately about apartments and how few apartments there are and the inventory's real low, if you talk to people that actually own apartment buildings, what they have told me is they are seeing more and more retirees take apartments as opposed to buying a home, which makes sense. So they may keep that in their home, or they may actually cash out and they may come here. Maybe because they were burned on the first housing bubble, or maybe they know that there's housing bubbles. But part of that filling of apartments locally is due to retirees, whereas probably 10 years ago, they weren't a big factor in there. So there's an interconnection. Yeah.
I know you talked about household size, but do you look at birth rate and all of that? Because a lot of our services deal with children, and I noticed that Asheville City Schools reported last week that their enrollment has increased, and I think Buncombe County's has increased.
We're sort of level.
Sort of level, but
yeah. And I don't remember the fertility rates. There was something I didn't share here because it wasn't very dramatic, and that was average household size, and it was only like a 10% smaller here. I also looked at single parent families, and it wasn't that different here than the nation. I've got to pretty easy to guess the fertility rate here is less than it would be other places, because remember I told you that 30-year-old group is packing up and leaving. So that is that group, you know, there.
Where on your wage spectrum did you find social workers, teachers, fire, police?
That's a good question. Educational services, you can look at it, if you look at it just as a private and public group, then it comes out middle. If you look at it as just public government, it comes out higher. It's not in the top 25%, but it's biased towards the higher side. And there were job losses, obviously, in that sector the last few years, so that decreased that proportion of that group.
If you look at jobs gaps, which you've done for us before, like if we're planning for what skills do we need to build for moving forward, where the jobs will be, has that changed significantly, or is it still pretty much those categories of healthcare?
Yeah, the projection in healthcare isn't unusual, and I have a little bit hard time with healthcare just because of the federal influence in the whole thing. And you used to be able to say, well, there's more older people moving in, so healthcare is going to be going up. And this is one thing unique about our area is we serve the entire western part of the state, really. The specialized care, not just the primary regular care. It's sort of a wild card now, and I have spoken to some people on the mission board who probably remain nameless, and there's a lot of different ways to measure healthcare and how they get incentivized right now, which is very complex. But they said a very good model to look at right now. You may have seen Haywood County, they're building this primary care facility. And they said that's because of the way the incentives are. They want to keep people out of the hospital and keep them at primary care. Now they say they're actually going to have to let people go on the surgical side, but they're going to turn around and hire more people on the primary care side. So it's in total flux. I'm the guy that usually measures the top line number. Underneath that, it's crazy land right now, and I don't really know if anybody knows what's going on. But I will tell you this is we are a very old workforce. I think we've talked about this before. And if you look at concentrations of old folks, it's in healthcare. You look at 10 years out in healthcare, I can't remember the percentages, but it's like 30% or so of those people are going to be gone. And the other one, hold your breath, is government services. And so look around you and forecast out, 10, 15 years, a lot of us in this room may not be here.
That's why we got Brandon.
I'm going to go for 14 minutes.
So when you're looking at skill sets, you're not just looking at industries that are growing, you're looking at industries that are aging. And we've got some real aging. Teachers are the same way. Teachers are aging. I'm trying to think. Manufacturing is too. Certain sectors of manufacturing here are on the biased on the older side.
It almost feels like from the economic development side that as we have brought jobs, which commissioners have focused a lot of energy on, it's almost specialized training you have to adapt to that industry more than what we used to do, which is train for tool or die or train. You know what I mean?
Yeah, and I could talk forever. The study I did for Mississippi just was interesting. So we didn't talk about schools at all. We said we don't really care what's coming out of your school right now. What we did is we looked at their existing workforce, and federal government has a fantastic database, not used very often, and it looks at occupations, and it has about 15 or 20 categories of skills that an occupation needs. So, somebody working at a website needs computer skills, they need design skills, that kind of stuff. And that's how we looked at the whole state, at those skill sets of people in their jobs who have those skill sets, and then they can move to different jobs and they take their skill sets with them. So it's a much more accurate way of looking at stuff.
Is that something you could look at for us?
Oh yeah, I'd love to. Yeah.
I mean, and if there are other things, Tom's always great about doing that kind of.
It's a sickness.
No, it's easy to get him distracted on something really interesting.
No, and that was, what's interesting about the Mississippi, because that was one where we really crunched the numbers, or I crunched the numbers, was they were perfectly suited for food manufacturing and those sort of industries where they didn't even know it, but they had all these people, not necessarily in food manufacturing, but they had the skill sets that were demanded by those industries, which is, working with machinery, working with routine basis tasks and that sort of thing. So, and I get to your frustration that I hear from like AV Tech. What do we train people to do? And I
For schools, public schools, what do we focus?
Yeah, I would say you probably don't want to focus too narrowly. I do focus groups a lot as economic development strategy, be in Johnston Community College here in a couple weeks. And part of the focus groups is you ask small and medium sized business owners, and you ask entrepreneurs in, and you ask them what their problems are. And I've been doing these things for probably 6 or 7 years, and you have to learn to kind of paint a straight face on, because you hear the same things over and over. You hear skill sets, and it's the ones it's showing up, it's not taking drugs, it's knowing how to learn. We'll give you a machine and we'll show you how to run the machine, but you got to show up and have, be able to count, do that kind of stuff. And I hear that everywhere. You hear it everywhere.
It's really kind of interesting because NC FAST has forced us to grow in economic services as an example I'll use very fast. As we began profiling applicants using a skills profile, that ability to learn, that learning index, is really what you begin to hire for. It's not so much what you knew, but how fast can I teach you something new.
It's curiosity, it's intellectual curiosity, that's about it. You can do anything with that, but it's hard to measure. And I don't know what schools can do about it. It's not Valley Way. Any more questions? I appreciate it very much.
Do we have a PowerPoint? Can you see it?
You've got it, it's right in there. But
Is it here? Okay.
I'll send it to you.
Somebody can get it.
I'll send you one that has sources. But
Okay.
by the way, people in my field would say I'm a bad guy because I don't have sources on every slide. It's Census Bureau, it's BLS, it's IRS. It's all big stuff. Nothing made up, nothing purchased. You bought it. This is your taxes. This is the data that you bought. So thank you very much.
Thank you.
It's very evident that when you look at the figures and everything, with all what the government does to the economy here in Buncombe County, really indicates some of the things that we get involved with, and many people how much Medicaid and Medicare do with the economy here in Buncombe County. So your information supports that. Okay, this gets us down to advisory committee reports, and I believe that Kibby, are you going to handle this, or Dawn?
I'll do it.
Are y'all okay with me just staying here to do this? The state lab processes water samples for us that come from requests from the community. And recently we received a fairly significant increase in their fees for a number of those tests. We assessed what we were charging for those against the increases, but we also looked at surrounding counties to see what they were charging. And the increases that we're requesting put us more in line with what's being charged in the region, but also allows us to at least cover our costs for the tests, not necessarily for the staff time and those sorts of things, but at least the cost for the tests that are run by the state lab. So the advisory council actually looked at that and came back with this recommendation for increases.
Mr. Chair, I move approval.
Do I have a second for that?
I'll second.
Seconded. Any questions? If not, then all those in favor say yes.
Yes.
Yes. Opposed, no. Very good. Thank you very much. Now, the next thing brings us to what I don't do.
We'll do a few things first before we do that piece. First, I sent an update, a general update, or shared an update with the Health and Human Service Board about some media requests we had regarding a child fatality. And she's going to do some briefing at probably not the next board meeting, but if there are any questions anybody wanted to ask today about process, we're happy to do that. Can't talk case. Or if we didn't answer any of those in the email, I'll just leave that open. And it's fine to catch Angie on her own too, and her teams. Raise your hand.
There's some
Her leadership team's all here too. So, I also do want to recognize that our department heads do have new managers. Anybody here today? Who do you have? Jennifer has. Laura is in the back. Tell us what she.
Laura Pless is our practice manager for the
Stand up.
service.
At least I didn't catch you this time. See. Yeah.
We're very excited to have her. Been a great help already.
Just because we met, Angie has none. Anybody else? Okay. I would note that this is, well, her retirement celebration is not today. It is Gibby's last board meeting. Very difficult to thank Gibby enough for the credibility around public health and the expertise she brought to our consolidation efforts. And I know she gets her opportunity for us to say all those things at her retirement celebration, but did not want to let today pass without acknowledging that. So, thank you. We're both avoiding it. And we'll let her stand up. It's Jan Shepherd, who, as y'all know from the announcement, is our new health director, and will be joining us February 9th. Comes to us as a sitting health director out of Madison County, which was a great transition for us because many of the healthcare systems and regional initiatives we're involved in, Jan's already been involved in as well. But also comes to public health through healthcare, a broader healthcare kind of background, which we think is a really good fit for some of the ways that we design and deliver public health. And as y'all know from changes in our organizational structure, she and Dr. Mullendorf will jointly lead public health on a peer level. So, welcome to And our board chair moved out of Canton. And I say, what was he thinking? General statute is very clear around residency requirements around health and human services boards, and they noticed that when we sent our board roster in. So Bill will be leaving us as a formal board appointment for that reason alone, but will remain with us in an emeritus chair. Bill was on. Many of you know Bill actually began much of his career in school administration, so we've known him as an assistant superintendent, a superintendent, a coach, assistant county manager, a DSS board member, a DSS board chair, and a health board member, and then our first and only today consolidated board chair. Very hard to articulate the degree of support and guidance and mentoring that Bill's given to all of us, not only myself, but to the leadership team and the board as we transition to a consolidated structure. Which, while we get lots of accolades and are noted as the best practice for our consolidated structure, for those of us, Suzanne and Dr. Oliver and Winnie and Dr. McClanahan who were here, who lived through it, it was not always fun. And it took a lot of all of our ability to see to the future and step over boundaries and look at how do we give up turf issues and move forward in a streamlined, consolidated way toward a common goal. And Bill was very often the voice of reason and the guide for all of us as we made those steps. And it's difficult to thank him enough for his service to Buncombe County and to this organization. And to me, spent many an hour mentoring me, for which he will continue to still do. So all of our heartfelt appreciation and love to you. Thank you. Yes.
I'll try to get through this because this is somewhat emotional for me. vision the future and then create it. In 1992, there was a vision that was made to the county commission about trying to put health and DSS together because they were handling the same people and doing the same thing to each one of them. And they very smartly made a ruling that this would start. And it sort of fell through for a while until this county was lucky enough to get, or what I call to go green. That's with an E on the end of it, won the green. And she came out, and she still comes out as a candidate. If you don't believe it, boom, she's something else. And I had her for 2 years as my assistant county manager, and it's very evident that I needed to get the heck out of there and let her go. And then another thing happened along the way. I forget the day. 2001 or 2, whichever it was. 1. DSS went to stone. They turned to stone. And between those two people, things begin to happen for what you now see and what you're now a part of. Those two people, along with the boards of commissioners and even the General Assembly, made it possible to see a vision come true. And for that reason, I'm glad to have lived that long, to see it, because I look back here at the employees, and it's amazing what this group has done. And I'm just glad to have been a part of it. It is very emotional. But thank you so much.
We do have a small gift, although you're not leaving us. You're going to be sitting right here every month in the emeritus seat. I'm not going to make you open this one if you don't want to, but it's fine if you do. It's not like a gag gift, I swear.
You want me to open it? Sure. I'm going to work all this.
All right, any other board members have anything I want to say? Suzanne's like me, mentored under him in many of her careers.
The mentoring is irreplaceable. And it's always nice to have that historical viewpoint that you give, that you're caring and your common sense. And I don't think there's ever been a meeting that you didn't appreciate staff and their hard work. And that human element is what I've learned from you, among other things. Thank you.
Well, I don't know whether this is an alarm clock or what, but it's very, very much appreciated, and it even has a statement up there in all my glasses on it. You want to read it?
That's where we are, Bill. In honor of your dedicated leadership on behalf of the Health and Human Services Board.
Thank you so much. I just don't know where they got it from the budget.
I promise, no way.
Yeah, I could probably tell you.
And, you know,
It was that line that stopped at the top.
that's right. That's that part we cut off. That's kidding, Vice Chair. Then leadership staff really wanted to honor what you've meant to us in a way that we thought would matter most to you. So we have established a William E. McElrath Leadership Development Scholarship that we will honor a member of our staff every year with the opportunity to competitively apply and let you, as you sit on the foundation board, weigh out their applications and every year honor a member of our staff with a leadership scholarship, the opportunity to, because that's so much of what you've been to all of us. I quote you all the time. I've learned so much from your mentoring, and we felt like the way we could most honor you is to continue to grow the leadership abilities within our staff. So.
Very good. Thank you. Thank you. I said, oh my God,
Moved out of town.
I moved out of Buncombe County. But it wasn't done on purpose, it was done because we found a place in which we liked it. I call it my pre-assistant home. And, but anyway, thank you all so much. And I think so much of this group and what they stand for. And I look at this tremendous board and Dawn, I'm grateful for your leadership. And I think it is a wonderful choice. And I look forward to sitting back and watching it still do its thing. And thank you all so, so much. And staff, thank you. Thank you.
Well, Bill touched on this, but Don will be our incoming Health and Human Service Chair, and both Dr. Oliver and Suzanne will continue to serve on executive committee, so we will continue to have that continuity, and we appreciate that. Unless there are other comments, you can do your favorite emotion to adjourn.
All those that want to go, get up and leave. Thank you.